So I've also heard people say, oh, you're having water retention, or you have X, Y, and Z, cut on the salt. How important is the salt, and should we really cut on the salt?
Okay, ideally speaking, we don't have to add salt, okay, and to our cooking and preparation and all these things. But having said that, so unless otherwise there is a salt in our food preparation, it doesn't taste good. And on top
Mm-hmm.
of that, the body is an ingenious system. Okay, when you take water, body doesn't hold on to that. I mean, salt. The body doesn't hold on to that excess salt and start accumulating water. Okay, it's
Mm-hmm.
a very poor correlation. There are so many other factors that are contributing for salt retention in a person. Okay, but unfortunately, we don't look into the rest of the factors. We identify that, okay, if there is a water retention, because sodium is having this tendency to hold on to the water molecules, people say cut down on salt. Okay,
Mm-hmm.
so but I see, I mean, like, we are able to help people reverse their hypertension with which they are suffering for 10-15 years, just by making their changes in their lifestyle, the way they eat food. Okay, not just by restricting salt. There are so many other factors. But this point, I mean, I need to explain this point to people. Okay, see, I'm a medical doctor, but I practice nutrition. In our medical education, what we see is we study single molecules. Single molecules means, say, for example, if someone is suffering with acidity, what we are doing is we'll give proton pump inhibitors. So omeprazole, pantoprazole, it is a single molecule. So we study this single molecule and its effect on the body, and we study the outcome. Okay, and this kind of single factor affecting the health of an individual is given thing in medical studies. Okay, that's how we do devise the studies. But when it comes to nutrition, it is multifactorial. It is not just one nutrient that we are supposed to study. In nutrition, there are way too many factors that needs to be considered. That's why we believe in personalized approach rather than giving a generic answer. See, if I say that, okay, cut down on salt, it will be a generic answer. Got it?
Mm-hmm.
But for me, no two hypertensive patients or no two people having water retention are same. They are
Mm-hmm.
different people. That's why in holistic approach, what we see is we don't see disease per se. I mean, disease we do study, but the person who is having that disease, we look into the causative factors for the manifestation of that sickness or illness in that individual, whether it is water retention or increased pressures or increased sugars. We look into the sponsoring cause and why, what kind of behavior, lifestyle behavior resulted in that particular cause and finally resulted in this outcome. So once we start looking into the cause of the cause, then the answer will become redundant. Okay, cutting down anything in excess is good for our health.
Mm-hmm.
It is basic common sense. But we cannot say across the board that, okay, cut down on salt. So I mean, you are from India, so we know this achar, pickles, and
Mm-hmm.
we have these fermented foods. And in South India, pickles is a good thing. And even in paratha in North India, they use this achar, and it is a
Mm-hmm.
preservative and it contains a lot of salt. So does achar or pickle cause hypertension? No. I mean, my grandparents, they have used pickles all their life. They are quite healthy. Okay, so that's what. So you cannot generalize the statement that salt is bad and that is the reason for water retention. We have to look into other causes as well.